Intralase surgery that I had. I had it the week of October 20th, and it's now December 8th today, and I just had my 1.5 month checkup. Everything went great. I'm seeing 2015. Perfect eye vision is considered 2020, so to be seeing 2015, I'm seeing even better than perfect, and everything is really defined. I can see, seems like for miles. I've been really happy with my results so far. In the beginning, the first 2 weeks, I was on a steroid eye drop, as well as for the first week I was on an antibiotic that I placed in my eyes 4 times a day. The steroid was 3 times a day, I believe, 3 or 4 times a day. And the steroid did give me a little bit of pressure here in my left eye. That went away pretty much as soon as I stopped taking the steroid at week 2. Lingered maybe a little bit, a week or two more, but nothing that lasted more than a few seconds. The day of my surgery, I was really nervous because I watched all these surgery videos. I wouldn't recommend that at all. It's very nerve-wracking, especially knowing what you're going into and seeing the lens pulled back and everything. So definitely, you know, as the saying goes, how is it? Ignorance is bliss, or something like that. I probably don't even have that one right, but yes, less is more as far as going in. Obviously, you want to do your homework on your surgeon. I wouldn't recommend going to any type of mill. My doctors don't have commercials on the radio. They don't have commercials on TV. I actually went to a really renowned place, UT Southwestern, to have mine done. And I'm, like I said, really happy with my results. They're very selective on their patients, and just don't take anybody as a patient. They only take the best of the best, the patients that they believe are going to have the best outcomes. And so far, so good. The procedure itself maybe took a few minutes per eye. It was more of my nerves and everything. A lot of places, especially my mom has had it done, and she's actually had it done twice because after 10 years, they figured out that sometimes people with worse vision, or, you know, pretty bad vision, kind of their vision starts to deteriorate. And so she's had what they call touch-ups. And so at the place she went, it was more mill-like, and so I knew I didn't want that, but they did give her a sedative to kind of calm her down. At my place, I was waiting and waiting and waiting for my sedative. I'm like, any minute now, I can calm down, because the paperwork is just worst case scenario kind of stuff. So I get back there and I'm getting more nervous and more nervous, and I'm like, any minute now. And finally, I asked the nurse, I'm like, so when am I going to get my Vicodin or whatever, Xanax, whatever it is? And she's like, oh, well, we quit doing that because it's really hard to, you know, some patients, it affects them more than other patients. And so whenever you're telling the patient to look at the laser, focus on the laser, and the patient's kind of like, huh, what, you know, not really paying attention, kind of out of it, then it's just really hard to communicate and get the surgery done with the patient. So they're like, we quit doing it here, although a lot of places still do it. If I would have known that, I probably would have tried to really talk them into giving me some kind of sedative to calm me down, because I'm already so anxious. And like I said, I did a big no-no in watching the surgeries. So yeah, it really wasn't that scary. Well, it was scary the day of, but looking back at it, I would 100% do it again. The scariest part was really when they go in to make the little holes with the laser, the Intralase. It suctions the eye, and well, on this eye, I could see a little blue light. This one, it was kind of black, and so then I started freaking out. And like, really, my sight's really not that bad. Like, what am I doing? What if I go blind? All that kind of stuff. I'm not sure that anybody has ever went blind from the surgery itself. There's lots of precautions that you have to take after surgery, but I'll talk about those here in a second. And another thing is, they need to pre-warn you when they're giving you the drops, because you're kind of sitting there not totally blind, because it doesn't go all black. You can see it's really blurry, but you can kind of see a little bit. And so you would just feel this like drop come out of nowhere, and every time I like jump back and I'm like, oh well, that was an eye drop. And so they numb the eye with numbing drops and all that great stuff. So when I got ready to leave, the doctors, made sure, took me back to the room and made sure that the lens was down in place. And I'm like, are these tears normal? And they're like, oh, you haven't seen a thing yet. They're like, for the next 4 hours, you're going to feel like somebody's poured Tabasco in your eyes. Your nose is going to be running. Your eyes are going to be hurting. The best thing we can say to do is go home and take like an anti-inflammatory, like ibuprofen, to help with the inflammation, as well as taking your drops. I'm allergic to hydrocodone, so they didn't give me any kind of medications for the pain or anything like that. And so they were like dead on. 4 hours was pretty bad. But then as soon as 4 hours left, it just went away with it. So I came home and took a nap and slept the rest of the night. You don't have to wake up and take your drops 4 times a day. Like the first 24 hours, you're taking your antibiotic every 2 hours, as well as I think you're still taking the steroid only 4 times a day. But you don't have to wake up and set your alarm. Like they're like, just wake up, or whenever you're awake, put it in every 2 hours. So I did that like clockwork. A lot of doctors tell you not to wear eye makeup for the first week, as well as don't get in pools or water or sauna or anything like that. My doctor told me not to wear eye makeup for the first 2 weeks. And just today, he told me I was okay to get into a pool or jacuzzi or something like that. So there is a bacteria in water and can get in the eye and cause issues. I don't know, I'm not an expert, but I would think that those issues would be like related to blindness and infections and all kinds of stuff like that. So I did shower with the goggles for the first, he wanted me to sleep in them for 2 weeks, which was kind of difficult. A lot of doctors only say 1 week, but he took every precaution. So happy to be at like week 2 and to not wear goggles, as well as they fogged up in the shower. So then I just started showering from the neck down, and having, to get help with washing my hair and all that good stuff. So you get really creative, but it's only like the first week and a half to 2 weeks that I think after like probably the first week, I just quit wearing the goggles in the shower because I couldn't see, they would fog up every time. And yeah, that's basically the precautions that he wanted me to take. And let's see what else. Obviously, no rubbing of the eyes. He still today said, don't rub your eyes or anything like that if they itch. Obviously, I can rub down here and up here, but like dead on, they don't want you doing this. I did get my makeup done, professionally done, for an event a few days ago, but she was aware that I had LASIK, really light strokes. And so, like I said, today, they said it was fine, the lens looked great, and it was healing and everything was in place. So like I said, I'm really happy with it and would totally do it again, only with the right doctors and all the right research. As far as research goes, I don't think watching a video of the surgery is really going to help much, but yeah. So if you'd like to know more, just post your questions below and I'll be sure to answer those. Thanks for watching. Bye-bye.